talk about Nexplanon, and unfortunately you guys are stuck listening to me for the next 100 slides because this is an FDA mandated training session, and unfortunately we have to cover all the slides or you guys can't be officially trained. So we're going to talk about it, how to put it in, take it out, all that kind of stuff. Yes? Do I have to use the microphone? Is that better? Louder? All right, so okay, I'll use the microphone because they need it for the video, I guess. So basically we're going to talk about how to put it in, take it out. The folders that you have in front of you, go ahead and open. Those have all the slides in there, and actually you can follow along. You can take notes in the margins, and actually you can star certain ones that you really want to refer back to. Once again, if you have questions, now's the time to ask them, okay? Because we're here to help you learn about Nexplanon, what's good about it, what's bad about it, and we can share our clinical experience with you guys so you can understand a little bit more about it. So we're going to talk about insertion, localization, removal, a little bit about the background, how to use it. So basically, Nexplanon is a single rod, one rod, good for 3 years, okay? One rod, good for 3 years. And this is what it looks like. That is not the actual size. It's actually 4 centimeters long and 2 millimeters wide. Now, when you tell a patient something's 4 centimeters long and 2 millimeters wide, they have trouble converting from the metric to the English system, and they think, I do not want a 4-inch rod in my arm. That's just not going to look very good. So actually, your kits that you'll get to play with later on, it's got this patient education piece in there, so you can show them exactly what it's going to look like. It's relatively small, and this will show them kind of how it's going to feel like when it's in their arm. You guys get, each of you get one of these to go home with, so you get to play with that. It's usually placed in the inner aspect of the non-dominant arm. So for most patients, that's which arm? Which arm? It goes in the non-dominant arm. So which arm would that go in? Left arm. Good, good, good. I want to make sure you guys are awake. If they're left-handed, which arm does it go in? Right arm. And if they're ambidextrous, and just choose one, right? So it's usually placed in the inner aspect of the non-dominant arm, and it works really, really well because it has a dual mechanism of action. Number 1, it suppresses ovulation, and number 2, it thickens the cervical mucus. Because of that, it works really, really well.